Limpopo has recorded an increase of 8 cases of COVID-19, bringing the total number to 54. This was because of the transition from level 5 to 4, interprovincial window period movement, and the resumption of operations in mines. So far, Limpopo has recorded 3 deaths with 30 recoveries. Phophi Ramathuba is the Health MEC from Limpopo and joins me via Skype from Polokwane. Very good morning to you. So it seems that a lot of factors have come into play leading to this increase that we're seeing there.
Morning and morning to all your viewers out there, and thank you for inviting us. I think yes, indeed, as we really anticipated, that is why we made a call as a province to say our advice would be prior the resumptions of duties, especially within the mining areas. We are appealing that what we can trust would be anyone coming outside the province who have not probably gone through our screening and testing should at least be quarantined for 14 days, because we know that's the only time when we can be reassured that the people are not infected. So if you look this increase, I mean, like this morning now, we just received another case. We are at 55. And the very same case is from the greater towards in Skukune. Prior to the lockdown, we were at 0. But now we've got 6 cases in just one municipality, and those cases are still active, and they are all, the 5 of them are all mine workers. And that is probably as a result where you would not know when were you infected. And the fact that you can take up to 4 days without us detecting the virus in your system, during that period you will be infecting others. That is why one of the cases, we have already found a contact with a fellow mine worker infected. So our appeal is still to say, before we take them underground, our employees, can we at least quarantine them? Yes, we are screening them. The screening might not give us the positive results. They might give us false negative. And we might think because somebody is not symptomatic, the test came negative, meaning this person is clear from the virus, whereas they're still within the window period and they become infectious. The very same case I'm referring for this morning, it's somebody who traveled from Eastern Cape on the 4th of May to come and resume his duties, and we were reassured by mine bosses that anyone coming outside the province would have gone through the quarantine, but we see it not really happening.
Okay, I know there was quite a bit of concern about the lack of strategy, the lack of transparency in your department regarding these numbers. Has that been addressed, and also the status of the quarantine facilities?
I think we are one of the department that has always been transparent from day one, and we have never hidden any statistics or any report. The misunderstanding becomes when probably some of the journalists would want us to pronounce on matters that are not within our competency. For instance, the protocols and guidelines in terms of communicating, if it's a death or if it's new cases, we must allow the minister and give him an opportunity and let the center hold. So immediately after the minister would have pronounced, then as a province would come and unpack and outline the details. So some of the colleagues from the media would then see that as we want to hide information from there. But we can reassure you, Limpopo is one of the provinces that on a daily basis we are updating in terms of statistics, but we must at the same time follow guidelines and protocol. We are led by Minister Dr. Mkhize, and we take a tune from him.
All right. What about schools going back?
We are working closely with the Department of Education. Our team in health, it's hard at work to try to advise. Similarly, we'll be guided by the Department of Basic Education nationally, working with the National Department of Health. As a province, ours would be to say, looking at the material conditions of the Limpopo, we are a rural province and we are not going to lie to anybody. Now, once the directive is being provided from national, what we will be doing as a Limpopo is to operationalize it so that it can be able to fit our situation. We've always been vocal to say we want to protect the most vulnerable, because while we are anticipating that very soon the honeymoon period for Limpopo of having all these low numbers will be over, as we have already indicated that we are starting to see a spike, especially within the mining area. Because if you look at our active cases, which are 22, 6 of them are in Waterberg, and all of them are within the Lephalale area, that's a mining area, within the Tabazimbis mining area, within the Mogalakwen, it's a mining area, within the Skukune, Greater towards the mining area. So that vulnerability of us having mines around, we should be expecting that we might be having a spike coming a few months, so even few weeks. So our preparedness would be how do we protect the most vulnerable so that we don't find them in the hospitals, because we will not win this battle in our hospital, in our ICU, especially when those with comorbidity get to be infected, our senior citizens when they get to be infected. So that is why our strategy in terms of even the quarantine facilities, we've already identified 127, we've already looked at 5,000 beds that we will be utilizing them not just for admission, but also for quarantine and protecting those with comorbidity. We are also working with our general practitioners who are in the township, in the villages, who knows the profile of the community of Limpopo. They know who's sick, they know who is old there, so they are busy profiling those elderly people whom, when the time comes, we will be able to quarantine them and protect them so that they don't get infected.
All right, MEC, good to talk to you. Thank you.